I want to talk to you.
Not now, later.
No, now.
Hello, everyone, and thank you for joining us for a brand new episode of OCuTALK. What kind of conditions does a neuroophthalmologist typically treat?
So probably the most common things that I see are what's called ischemic optic neuropathies, or basically strokes to the eye. And there's various causes, be it from diabetes, hypertension, certain medications. I also see people with vision loss, whether it be a blind spot in their vision from a tumor. I also see people with double vision for various causes, including muscle diseases like myasthenia gravis or other nerve-related or muscle-related type issues.
You can talk to us a little bit about astigmatism. What exactly is astigmatism?
Oh, good question there. And I'm excited to talk to you about it. We hear the word astigmatism all the time. Some patients even tell me they have stigmatism, but there is an A in front of it. Astigmatism, it's a condition in which your cornea of the eye is uneven or not, perfectly round, causing a blurring of the vision, whether it be distance or near.
And so why would someone need intraocular lenses?
Well, that's a great question. So typically, you need an intraocular lens when you've had cataract surgery, but some people will still have surgery to take out their natural lens even before they develop a cataract. So it's still actually the same surgery, but maybe they're younger and they haven't developed a cataract, but they're unhappy with their eyesight. So many of us already know about, the phrase Lasik. Lasik is different because Lasik is changing the shape of your cornea. Some patients are not eligible for Lasik for whatever reason. It could be their prescription's too strong, or they have other corneal diseases that doesn't allow for them to have laser vision eye correction. So another option is to actually go in, remove the person's native lens, which again is the focusing power of the eye, and replacing it with a different focusing power to actually fine tune or customize their prescription and maybe even remove the need for glasses. So anyone who's having any kind of lens-based surgery is going to need an intraocular lens.
Is there a medical procedure that we can do to help us change our eye colors?
So the short answer is no. The safest way for you to temporarily change your eye color, as you mentioned, is going to be a prescription and fitted color contact lens for you.
Surgery, there could be a possibility of complications.
Yes,
so what are the complications that people should know about going into this type of surgery? And what's the success rate of a corneal transplant?
It's a great question. So, of course, any surgery or procedure has its risks. Significant sight-threatening risks are very rare. These are things like intraocular infection or endophthalmitis, retinal detachment, recurrent inflammation. Those are very rare, but they do happen. I'd say the risk is probably about less than 1 to 2% there. So very low. Now, risks that are maybe a little bit more common include graft rejection and graft failure. And remember, we talked about how these risks are relatively lower compared to full body transplants that involve other parts of the body. But that risk is still there. Now, with a DMEC and a DSEC, because we're just transplanting just a small amount of tissue, that risk is very, very low. Very low. Now, it is a little bit higher with a full thickness transplant, but again, very low risk. And I tell my patients this. I do have my patients on a steroid eye drop for an extended period of time to prevent rejection and failure. And that actually tends to do the job quite well.
But what's very interesting, what I find that some patients are very, very astute. And I actually had a patient who was a graphic artist, actually. And she came in with a macular hole. And she actually came in and presented sometimes what has been described as an early pathologic presentation of a macular hole. She drew a yellow spot for me, actually, as in her vision, with colors, actually. She came in and she brilliantly drew this color diagram exactly of what Donald Gass, who was really who really found macular holes. He was the one who discovered macular holes back in the late 70s, essentially, and early 80s, and described the pathology. He used to call it a yellow spot sign. And And she was able to draw this yellow spot sign really very beautifully. So sometimes patients will note even a tinge of color in their vision, and that's a sign that they may even have an early macular hole.
Dr. Guyman, what causes pterygium of the eye?
Let's see here. The big cause, or the things that are associated with pterygium, is you're exposed to UV light quite a bit. So UV light damage. Also, if you're in a dry, dusty environment, that can definitely make you more prone to develop a pterygium. And that's also why that's kind of coined the term a surfer's eye. So people that are out surfing, they're not wearing sunglasses, they tend to develop a pterygium, and so that's kind of like where it comes from. It comes from there.
How long does pink eye usually last? You said like it's kind of like sometimes like if it's viral, it's like a common cold. How long does it typically last for somebody?
Yeah, typically it'll last anywhere from 1 to 3 weeks, and it's kind of like a long time frame or range, but that's just because it depends on how well you kind of maintain and keep your eyes clean. So for some patients, if they're not doing a great job, it could spread to the other eye. So some of the tips that I tell people are, of course, all the things we already talked about, like contact lens use and not abusing them, keeping your eyelids and your eyelashes clean, but also other things to think about would be like washing your pillowcases, anything that comes in contact with your eyes, or face towels. So don't reuse them when you are sick, just like you don't want to reuse a tissue, right? So you want to clean everything that comes in contact with your eyes as well.
Are there any cases that you've come in contact with where, no pun intended, but contact lenses are better than glasses?
Yeah, so sometimes, we have patients that actually have a very large difference in the power correction between the two eyes. And when that happens, that can often lead to the world almost feeling like a different magnification. And so this is actually called anisoconia. So some of these patients actually really benefit from being in a contact lens versus glasses. And then sometimes you just have patients that have a very active lifestyle, or even a job that requires them to use their full visual field. And so for these patients, contacts are probably a better option.
What causes this eyelid twitching?
So while the exact cause isn't really known, there are certain things that can trigger it. So extra stress, lack of sleep, extra caffeine. There's some nutritional things that can cause it, like low magnesium, alcohol, tobacco use, and then like eye strain, irritation, things like dry eye allergies, and other stuff like that.
The signs or symptoms that people can be on the lookout for to indicate to them that they may need vitreoretinal eye surgery?
I'd say the most important one would be any like loss of vision. So if there's a sudden vision loss where the vision gets very blurry suddenly, that would be a very serious consideration to go get your eye examined and see if you need vitreoretinal surgery. Onset of many floaters is also one that should be taken seriously. It's common to have some floaters at baseline, which are those little dots or lines that cross our vision. But if there's a big change in that, take that seriously. And then also flashing lights in the peripheral vision typically could be a symptom, meaning a retinal tear is forming. And so that should be checked out promptly as well. One other one would be like if the central vision is starting to get distorted and wavy, like instead of seeing straight lines, they're kind of crooked or wavy, that could be a sign that something is changing in the macula that needs attention, whether that be scar tissue forming on the macula or swelling of the macula.
What makes a patient good for refractive surgery? Can you go into a little bit of that as well?
So what refractive surgeries such as Lasik and PRK do is they take the vision that you see with your glasses and contact lenses, and they make it where you no longer need those glasses and contact lenses. Because of this, it is important that one already sees well with their glasses or contact lenses. This means that they have healthy eyes. If there is any issues with the eyes, dry eye being a very common one, it's important that we treat the dry eye ahead of time in order to give them the healthiest eyes possible going into any sort of refractive eye surgery. In addition, it is also important that the prescription is stable as well. If the prescription is continuing to change, I wish this can happen for younger individuals before their prescription is stabilized, then ultimately that can affect the results and reduce the accuracy or the longevity of the treatment. So overall, if your prescription is nice and stable, it's been stable for years, you see well, you have healthy eyes, then that frequently makes you a very good candidate to get your vision corrected with LASIK or PRK.
What are some measures people can take to avoid eye care issues and still kind of have that eye makeup around their eyes?
Yeah, of course. I mean, I love makeup. I'm not going to stop wearing makeup. I think it's more about, knowledge is power and knowing what kind of things to look out for. So I think one of the main things is try to limit the amount of waterproof makeup you're using. Of course, if you're going to a wedding and you're going to cry, fine. I do sometimes use it on occasion, but I've definitely switched over to, some healthier, cleaner makeup brands.
To Dr. Samji, and you actually talked a little bit about like maintenance of the eyelid. Do you actually have like a follow-up, a home follow-up for your patients? Would you recommend anything for long-term condition maintenance?
Yes, that's a good question. So everyone that goes through our dry eye spa gets a take-home kit. And in that kit, we'll give them something to do warm compresses with, because once we've opened up those glands and things are flowing again, they need to maintain that. And the way I like to explain it to patients is, hey, you just came in for a deep cleaning and a treatment. Now you're going to go home and floss your teeth and brush your teeth, right? So it's the same analogy I use with them. We've opened things up. You're going to keep things open. Omega-3s are really important also. We touched on that, and that's kind of part of their kit. And then lid hygiene is another one. So you want to get rid of all that biofilm, all that stuff that can accumulate and cause more inflammation on the lid margin.
Are there ways to avoid any of these infections? Like, are there preventative measures that can be taken?
Yeah, for the first kind of microbial keratitis that you can develop, is just a lot of the time it's related to overextending contact lens wear, sleeping with contact lenses. Of course, there's a lot scarier infections that can be related to tap water use or to contact with vegetative materials. So avoiding any of those. So again, following your contact lens provider's guidelines there. And in terms of ocular surface related issues, definitely cleaning the lid hygiene is very important. Keeping the ocular surface clean and the eyelids clean regularly is actually very important for contact lens success.
Do you have like an actual treatment protocol for patients who have or are presenting like mild to moderate dry eye?
Yeah, so I mean, we go through the same type of questionnaire, right? So we want to make sure we identify all the risk factors and what's causing their mild and moderate dry eye. And so usually for the mild dry eye, it is a little bit of possibly some lifestyle modifications that can help.
So these patients usually get level 1 to level 2. These involve, a steroid for acute inflammation that I also give them as a pulse therapy whenever they need it for their flare-ups. I usually get them on some preservative-free artificial tears, OCuSoft lid scrubs, of course, for the cleaning the lid and just overall hygiene, which is very important, as we know. Another really, really big one is nighttime ointments. There's a lot of people that sleep with their eyes open. And so adding a little bit more moisture at nighttime goes a long way. And then we talked about that anti-inflammatory diet and supplementation, and essentially vitamin C and GLA are my go-tos for that.
What are the complications can happen with the eyelids that will affect the eyes and our tears?
So there are a variety of conditions that can affect the eyelids and also affect our tears. The most common ones that I see in clinic are blepharitis and meibomian gland dysfunction, which is basically when that inflammation of the eyelid is secondary to the clogging of those meibomian glands. That produces redness and dry eye. Things like hordeolums, which are styes, can also affect the eye and the glands of our eyelids. And conditions like ectropion, which is basically the outward turning of our eyelid margin. Because the eyelid margin is positioned outwards, it causes a lot of irritation and dryness to the cornea. And that's just a few of them. There's a lot of diseases that can cause dry eye and that affects our eyes and cause dry eye.
What makes a good candidate for LASIK surgery?
So generally, we're looking for people who are 21 years of age or older. We want to make sure that your glasses prescription has been stable for at least a year. And we want to make sure that you have a good general health of your eye. And it's also helpful if you're generally healthy overall, which most LASIK patients are. It's also really important to make sure that our patients are not nursing or pregnant at the time of LASIK surgery or at the time of their evaluation. And the reason for that is being in either state can actually temporarily change your refraction or your glasses prescription. And so again, we want to make sure that you're stable. So either not pregnant or being done with breastfeeding before we were to do a procedure like LASIK.
What signs should someone be on the lookout for to know that, hey, maybe I should probably look into this type of surgery? Is it when I get older, in my 40s, when I have farsightedness, or what type of signs should I be looking out for?
So basically, if you're tired of your glasses or your contact lenses, you're having difficulty performing your hobbies, your day-to-day tasks, your job, whether because of your vision or your glasses getting in the way or your contacts, or you have all these issues related to those things. Like, for example, some people develop significant dry eye from their contact lenses because they're so dependent on them. But they have to wear contact lenses because of their job. Glasses are just not possible. So in general, if you're struggling with your vision, having an evaluation where the options can be presented is my suggestion. Often, and I don't expect a person to know that they need what they need exactly. All they need to do is talk to their eye doctor, and the options can be presented to them. And then sometimes it will be up to them, but a lot of the times the doctor will make the recommendation on what would be best for them and their vision and their lifestyle and their future. So just to reiterate, a person who just struggles with their vision and is looking for options, struggling with their vision and specifically the correction of that vision, which is the glasses or the contact lenses.
Who do you think would be an ideal candidate for a blepharoplastic surgery?
So for cosmetic surgery, I think it's a matter of if it bothers you and I can find an issue with it, like enough for me to address, then you're a candidate for it. I am on the conservative end of plastic surgery because as a primarily trained ophthalmologist that then trains into oculoplastics, our main goal first is to protect the eye and protect the vision. And if I think that any kind of surgery is going to be detrimental to your eye, I'll most likely not recommend it. So if you go to an oculoplastics with unreasonable expectations or unreasonable results, then we're most likely going to steer you away because it's going to cause issues like dryness, irritation, or even down the road. It may look great at first, and then if at some point the aging process happens, and then the eye may take a hit down the road. So we always think just not of the now, but also of the future.